Okay, good morning. I'm Dr. Sanjiv C C, Senior Neurologist and Movement Disorder Specialist. I've been practicing in Bangalore for the last 30 years. I'm specialized in movement disorders. Way back, say 2001 in Canada and also US. I moved to Bangalore in the last nearly 28 years. My field of interest is Parkinson's disease, movement, other movement disorders that includes dystonia, chorea, botulinum toxin injection, and medical and surgical management of Parkinson's disease as well. As a team, we work together. Myself and Dr. Sharan Srinivasan. He is a neurosurgeon, but myself is a neurologist and movement disorder specialist. So first, initially, we will work up the cases, and medically, I try to manage myself. In case the disease is progressing and resistant to the drugs, then we opt for the surgery. That is, after discussing with the patient, we put up a detailed plan to them, and then we tell them this is the medicines has got limitations. After that, we need to move on to surgery. Then, regarding the management with medical treatment in Parkinson's disease, we have got various drugs, including the injection, so-called apomorphine, which can be introduced after a certain period of time. Initially, we tried with oral medications. Then subsequently, we try with this thing, injection apomorphine. This is the step before the surgery for the Parkinson's disease. See, along with this medical drugs, and we need to have put the patient onto physical therapy. That is a neuro rehabilitation therapy. That's very essential to sustain them with the medicines for a long period of time before going for surgery. So neuro rehabilitation also plays an important role in the management of Parkinson's and other movement disorder. Coming to the dystonia is again one of the movement disorders signs and symptoms. We need to identify what type of dystonia, the focal dystonia or generalized dystonia. Depending upon the focal means one side, generalized means whole body. We need to categorize first, then the drugs should be introduced. For focal dystonias, there is the one side. If it's affected, we do have botulinum toxin injection, which can release the muscles contraction. Usually, it's given once in three months for a large number of this longer duration of period. In dystonia, initially they may respond to the drugs or the botulinum toxin. In case if it is progressing and not responding, again we have to opt for this surgery. Surgery, again there are two types, as I told you, like Parkinson's disease. For dystonia also we have lesionectomy and DBS. Depending upon the financial status, we can opt for the surgical modality of treatment. As a team, we are involved in surgery also. I do go to OT theatre and assess Dr. Sharan Srinivasan in the pre and peri and post-operative management of movement disorders that includes Parkinson's and dystonia. As a neurologist, we see the patient again in the OT. We will do some assessment after every frequent surgical steps. Okay. Then post-operatively we have to do scanning and see the site of whether the site of lesion is corresponding to our anatomical and physiological assessment of the patient. As a team, we are also involved in education program across the globe. We also give lectures on various topics of movement disorders, both nationally and internationally.